So the question was, do I think an 18-year-old should be able to buy a rifle, an AR-15 in particular is what Paul asked about. And I would say in the state of Nebraska, the answer is absolutely yes.
Why is that?
Well, most people are, the question, Paul, is why is that? Well, most people here in Nebraska are law-abiding citizens. And we ought not to focus on the gun, but the person who's pulling the trigger. That's where the real problem lies. And that's why I've said we've got to get at the root cause of this, which is looking at mental health care. In fact, there was a study out last year from Stanford University that looked at 35 of these mass shooters and determined 28 of them had untreated mental health care problems, for example. And so that's why, for example, in our ARPA budget, we put $40 million in for expanding mental health care services, another $5 million to encourage people to go into the behavioral health field and nursing field. We've got the money we allocated to UNK, for example, to make sure it's not just in Lincoln and Omaha. We've had additional things with regard to our system of care, where we have taken our grants to be able to help expand mental health care. We were piloting our open access right now, and open access beds, so that we can make sure that people who need that mental health people can get more readily connected with it. Later this summer, actually in July, we're going to be rolling out the 988 National Helpline for people with mental health care needs to be able to call and get a hold of a counselor right away. So there's a number of steps that we're taking. And of course, Department of Health and Human Services has worked with the Department of Education on training more folks in schools. In fact, last year we had 943 people were trained on mental health first aid to be able to help do early interventions with people who will need that help. We need to focus on the person, and that's what we've been doing here in Nebraska. And U.S. News and World Report actually says we've got the third best mental health care in the state, or in the country.
Wouldn't red flag laws do that? If you want to focus on somebody who's disturbed or having a mental break, wouldn't that prevent somebody with a mental break from getting a gun?
So Paul is asking about red flag laws, and again, I would point out that those are not perfect. For example, New York has a red flag law. But also, just in general, when you think about it, this is a constitutional right, so it's a pretty high bar to restrict it, and you have to go to court to restrict anybody's rights. So you have to go to court. People have to have due process if you're going to restrict their rights.